The Ring of Fire.
Welcome to the Ring of Fire, the weekly terminology practice session for interpreters of all levels in all languages, including American Sign Language. Thanks for joining me. I'm your host, Maritza. This is Ring of Fire 20, and it will be the last Ring of Fire episode. Thank you so much for joining me in the previous episodes. This episode will also be the longest episode. I have a long list of medical and legal terms for you. I want to clarify that this is the last Ring of Fire episode, but there will be episodes for interpreters and interrupters. I'm not doing away with the podcast, just with the Ring of Fire episodes. The podcast will continue to give you valuable information as well as interviewing other interpreters. Before we get started, keep the following tips in mind. Tip number 1. Create a glossary if you haven't already done so. You can create your glossary using Google Sheets or Microsoft Excel. And don't forget to categorize the words by creating tabs in your workbook. I have a couple of announcements. Number 1 is that I haven't been recording episodes in the past 2 weeks because I started a job. I'm a medical interpreter at a huge medical facility. It's so wonderful to be able to work with people in person. The second announcement is regarding the Global Workforce Survey for Healthcare Interpreters. It's been published by Certification Commission for Healthcare Interpreters, also known as CCHI. The survey is open for currently practicing interpreters who serve the U.S. healthcare and health system, as well as any field that interacts with medical providers, regardless of whether they reside in the U.S. or not. It's the first survey of this kind, and its purpose is to understand the demographic makeup and practice of healthcare interpreters who serve U.S. patients and providers. I'll place the link to the survey in the comments. Ready to learn some terminology? Here we go. We're going to start with legal. This list is very long. So my suggestion for this episode of Ring of Fire is to listen. And if you know the term, don't write it down. You don't have to add it to your glossary because you already know the term. But have a pen and pad ready so that you can write down the words that are new to you so that you can add them to your glossary. Legal category. Abstract. Brief. Bring an action. Care, custody, and control. Carjacking. Cease and desist. Change of venue. Default judgment. Deterrent. Egregious. Enter an order. Frivolous. Garnish. Grant. Guidelines. Habitual offender. Halfway house. Inadmissible. Indecent exposure. Irrelevant. Joint petition. Joyriding. Knowingly. Law-abiding. Leniency. Maintenance order. Mutually agreed upon. Notarized. Off the record. Pain and suffering. Quash. Reckless. Statutory rape. Terms and conditions. Unsupervised probation. Visitation rights. Work furlough. Remember that the list of these words are in the comments. Now we're going to jump to medical category, and this list of words all have to do with dental. Ready? Abscess. Abutment crown. Adult dentition. Allogenic. alloy, amalgam, apex, bicuspid, bilateral, bite, bite wing radiograph, bridge, cavity, cleft palate, composite, cracked, loose, or missing teeth, crown, palate, wisdom teeth. Still in the medical category, I'm going to read terms for vision. Ready? Farsighted, nearsighted, age-related macular degeneration, astigmatism, readers, progressive, glare, flashes, floaters, blind spot, cataracts, congenital endothelium, episcleritis, epithelium, gritty sensation. Now, gritty you can interpret as sandy, or depending on the language that you're interpreting to, your target language, that word gritty, you can interpret it as an explanation. That sensation that you feel like you have sand in your eyes. So if you don't have a word for gritty in your language, just go ahead and explain it. Next terms: lazy eye, ocular hypertension, optic nerve, optical coherence tomography, peripheral vision. How did you do? Did you feel like you knew most of these terms? Were some of these terms new to you? Let me know in the comments. I interpret quite a bit at the eye center at the medical facility where I work. So I had to learn all these vision terms, and I'm still learning. I went to a surgery, guys, an eye surgery. That was pretty wild. I didn't feel queasy or anything, but to see the patient's eye on a monitor and then see the eye surgeon poke the eye with needles and attach other things to the eye so that they can do whatever it is that they're doing during the surgery, that was pretty eye-opening. Sorry, couldn't pass up on the dad joke. Hope you have a wonderful week. Don't forget to like, subscribe, or tell others about Ring of Fire episodes. I'd really appreciate it. I hope you join me for the next episode of Interpreters and Interrupters.